The following segment is paid for by Holston Medical Group.
Eating disorders can take a serious toll on a person's health and well-being. Establishing healthy eating habits early on is important. Doctors say these disorders can begin developing at a young age. In tonight's Health Matters by Holston Medical Group, we sit down with a pediatrician to learn important information for parents.
It used to seem like it was more in the high school and college age, but now even middle school students are seeing things on social media. There's a huge trend for dietary supplements and a lot of fad products, that kids or adolescents think that they need to be healthy. And so they'll ask questions about those things or sometimes feel like they need to restrict their eating to fit a certain size.
Dr. Danielle Stephens urges parents to watch for early warning signs of eating disorders. She says there can be both physical and emotional changes.
Becoming almost obsessed with calorie counting or counting macros, protein, carb, and just really being interested in exactly what they're eating every day. And then there's physical changes such as excessive fatigue, falling asleep during the day, obvious weight loss that's pretty drastic to the parents or caretaker, and then mental health changes, so new onset of depression, anxiety, tearfulness, things like that.
Dr. Stephens says parents should be good role models, demonstrating and discussing healthy eating habits and behaviors. They should create a mealtime environment that is family-focused, getting rid of distractions.
Because it really starts at home. So a big thing is to not talk about weight loss or healthy versus not healthy, but really talk about nutrition, feeding our body to be healthy, to give us energy, and not labeling foods as good or bad. Everything's okay in moderation, and so talking about how we get the healthy nutrients that our body needs for energy.
Dr. Stephens says communication is important with your children, but also with your pediatrician. She advises parents to reach out with any concerns.
Let us help you. Come see us at your first concern. So maybe you've noticed your child becoming really interested in foods, maybe not in a healthy way, or you've noticed that significant weight loss, or you've noticed them really restricting what they've been eating or skipping meals. Come in and we can talk about it and address it. Early identification is really important.
Dr. Stephens also says those annual visits to the pediatrician address a lot of those concerns, checking height and weight as well, making sure they're on the path to good health and wellness. For more information, please visit the Health Matters blog at holstonmedicalgroup.com.